Hi, I'm Dr. Kaplan from Helios Telemedicine for Men, and today's topic is what is sex hormone-binding globulin and why is it important? I have shortened the lists on today's video. However, you can catch them in their entirety on my Wednesday post. I thought that this video was going to be one of the easier ones, but boy was I wrong. After all, we've known for a long time that sex hormone-binding globulin, SHBG, was a protein made by the liver that increased with age and attached to testosterone, taking it out of useful circulation. But recent research has shown it is so much more. There are receptors for SHBG on cell surfaces. And we know that if the SHBG binds with testosterone in circulation, it cannot attach to these receptors. However, if it attaches first, it can bind a testosterone later, which means that free testosterone, free SHBG, and SHBG, which binds to a cell and then testosterone, have their own different ways of communicating messages to the cells. There is even a fourth pathway, but it is too complicated for this video. We know that population-based normal ranges for SHBG run from 10 to 57 nanomoles per liter, but your own personal range is likely to be much narrower. SHBG is reduced with obesity, diabetes, hypothyroidism, kidney or liver failure, and taking some medications. The consequences of having a low SHBG include erectile dysfunction, insulin resistance and diabetes, metabolic syndrome and heart disease, non-alcoholic fatty liver disease and liver failure, increased central weight, and increased risk for all-cause mortality. There are no medications available specifically to raise your SHBG levels. However, some have recommended that increasing the caffeine or cadmium intake or reducing protein intake may help with this. No guarantees, and I would advise moderation. You can see elevations in SHBG with hyperthyroidism, elevations in estradiol or FSH, diabetes, inflammatory diseases, taking some medications, or overuse of alcohol or taking cigarettes. Those with elevated SHBG may find themselves with hypertension, osteoporosis and fractures, elevated bad cholesterol and heart disease, gallstones requiring the removal of the gallbladder, and degenerative joint disease, which causes joint pain and possible need for surgery. You can reduce your SHBG by losing weight, reducing your alcohol and caffeine intake, cessation of your smoking, reductions in your simple carbohydrate intake, increase in protein intake as well as that of cruciferous vegetables such as broccoli, cauliflower, and bok choy. Use of some medications to reduce the estradiol, which might reduce the SHBG, and the use of some vitamins, minerals, and herbs. So, SHBG is an important protein that acts through multiple pathways to deliver messages to cells and has significant consequences, whether it's high or low. Next week, we will be talking about a quick overview of how is testosterone deficiency treated. In the meantime, you can get started with our self-assessment survey on our website at www.heliostelemedicine.com, where you can also catch up on our prior videos or make an appointment to see me. You can follow us on Facebook, Instagram, and YouTube at Helios Telemedicine for Men. Thank you for your time and attention. Goodbye for now.